Assalamu alaikum. Bismillah ar-Rahman ar-Rahim. Uh, this is my first presentation in a series of discussions, hopefully, uh, to help our young counselors, psychologists, graduates who will be providing services over this hotline that's been created by Omang organization. It's very encouraging to see this work coming up and being offered, these services. So I'll be speaking interchangeably between Urdu and English. So just to make it a little bit more understandable. The first discussion is about psychosis and bipolar disorders. Psychosis is okay, before I define psychosis, I would provide a brief definition of psychology itself. Psychology. People seeking help over this hotline, they are mostly having emotional disturbances, emotional difficulties. Now they either experience it themselves or someone has encouraged them to seek help. Psychology is about emotions. It's not only about emotions, it's about mind and behavior, it's about cognition, it's about social, economic, and academic problems resulting from emotional problems or cognitive problems. So mind is is the prime focus, but emotional disturbance is what becomes the center point. It becomes the main focus area of psychology. Psychology deals with these aspects of personality, and we should not be quick to judge or diagnose a person. Be very careful that when we come across a person, a client calling us, I'm using the word client to show respect to the person, so we don't easily call the person a patient, and we do not easily jump to a conclusion or diagnosis. Client is a person seeking help. It may be for some adjustment problems, it may be a more severe condition, it may be something that does not meet a particular criteria of a psychological disorder, but still is classified under a name. It's a disorder, but may not be a very severe disorder. I will discuss some of those. So psychology is about emotions, and people who yeah, so I was using the word client, I was telling you. Okay, so psychosis is a break from reality. यानी आप जिस ज़मान व मकान में आप जी रहे हैं, अगर आप उससे आपका कनेक्शन टूट जाए, यानी आपको यही ना पता हो कि मैं कहाँ हूँ, ये कौन लोग हैं, कौन सा साल है, मैं कौन हूँ, या any of these this is disturbed, so obviously this break from reality is a problem, and this is called psychosis. Psychosis is a break or disconnect from reality. Psychosis itself is not a disorder. It is a symptom, a condition that accompanies disorders. For example, schizophrenia may have psychotic features. Severe depression may be accompanied by psychosis. Other disorders may be accompanied by psychotic features. There a person loses connection. It's possible that a person who is psychotic is hearing voices or is seeing things that are not real. There's no sound in the environment, but his brain is creating sound, or he's seeing things, hallucinating, and there is nothing outside. Saying angels, dead people, or he may claim to see prophets, or whatever the case. The person is seeing things as real, as if they are present in front of this person, and none of that is there. So those are could be some of the signs of psychosis. Mood disorders. Disturbance, I'm defining mood disorders. It's a disturbance in mood that causes clinically significant distress or impairment in a person's social or occupational functioning. Disturbance in mood, यानी मूड जो है वो उसमें किसी किस्म का डिस्टर्बेंस आ गया, यानी इंसान बहुत ज़्यादा अफसरदा हो गया, बहुत ज़्यादा डिप्रेस हो गया या एंक्शस हो गया बहुत ज़्यादा, ठीक है, या स्विंग हो रहे हैं उसके मूड्स, नॉर्मल से अचानक मैनिक हो जाता है, बहुत ज़्यादा एलिवेटेड फीलिंग हो जाती है उसको, सो ही नहीं पा रहा है, रेसिंग थॉट्स या बहुत ज़्यादा बातें, बहुत ज़्यादा या ऐसे बिहेवियर्स हैं जो वो कर रहा है, या मिसाल के तौर पर थिंग्स में बी प्लेजरेबल लेकिन वो जो हैं रिस्क टेकिंग बिहेवियर्स हैं, मसलन गैम्बलिंग और या बहुत ज़्यादा पैसे खर्च करना शुरू कर दी, एकदम लुटाना शुरू कर दी. सो disturbance in mood, that causes clinically significant distress. तो अब ये मूड स्विंग्स हैं, डिप्रेशन है, एंग्जाइटी है ना, उसकी एंग्जाइटी नॉट इन द जनरल सेंस, क्लिनिकल एंग्जाइटी, क्लिनिकल डिप्रेशन, उसके सब अपनी क्लासिफिकेशंस हैं, सिम्टम्स हैं, क्राइटेरियन है, वो उसको मीट करना चाहिए. एज काउंसलर्स, एज साइकोलॉजिस्ट, वी कैन नॉट use words very lightly. We have to, when we say depression, we should know what do we mean by depression, which kind of depression we are talking about. Okay, so mood disorder is a disturbance in mood that causes clinically significant distress. Distress जो है एक ख़ास हद तक परेशानी बढ़ गई है, और impairment यानी हद से ज़्यादा इंसान परेशान हो गया, क्रॉनिक जो है वो डिस्ट्रेस है. मसलन एक आदमी है 3 हफ्ते मुसलसल जो है वो डिप्रेशन है उसको, रात दिन, विच मीन्स दैट ही कैन नॉट फंक्शन एनी मोर, इज फीलिंग लो एंड नॉट मोटिवेटेड, उसकी जो एपेटाइट उस पर असर पड़ा है, कैन नॉट स्लीप वेल एंड एनी ऑफ दोज थिंग्स. और इम्पेयरमेंट इन अ पर्सन सोशल लाइफ इम्पैक्ट हो गई. अब वो जो लोगों से जो मेल जोल है उस पर वो ख़राब हो गया. ऑक्यूपेशनल फंक्शनिंग, यानी वो जॉब जो अपनी नहीं वो कर पा रहा है. मेरे जहन में बहुत सारे क्लाइंट्स आ रहे हैं इस वक्त. ऑक्यूपेशनल फंक्शनिंग यानी ही इज़ नॉट एबल टू परफॉर्म हिज जॉब रिलेटेड ड्यूटीज़ और इन हिज और हर एबिलिटी टू फुलफिल अदर इम्पोर्टेंट लाइफ रोल्स. मतलब पहले आर्ट में जाता था, ट्रैवल करती थी, मसलन यूज्ड टू engage in other activities, right? Social activities, other things not related to job or family, some other interests, hobbies. Now this person is unable to perform those, lost the motivation or just cannot. All right. So mood disorders, we have to be careful. Mood disorders are quite a few. There are many. So in order to pinpoint a mood disorder, the client must meet diagnostic criteria. So major depression has its own criterion, right? Bipolar 1, which has more manic features, bipolar 2, which has more depressive features. According to a minimum certain number of days it should continue. Dysthymic disorder has depressive features but not at the level of major depression. And I'll name a few others other than hypomanic episodes, dysthymic disorder. There are quite a few others. So what I'm saying is that to pinpoint a disorder, there should be these counselor must look at the DSM-5 manual and look at the criterion before giving any label to the person. Label can help as well as create a problem for a person. Label can accompany a person, and also because a person may at times when a person is diagnosed quickly without enough observation, it's possible that this person may just say, okay, so I am such and such, therefore it's okay to be like this, and justify one's, so whatever be the case, there's a whole range of mood disorders ranging from different levels, and some requiring a minimum duration specified, while others not meeting that condition. So for now, we can summarize this: the meaning of psychology, psychosis, and mood disorders. I named a few. Uh, Bipolar 1, which I mentioned, that a person feels manic. There's a swinging of mood between normal or slightly depressive to manic side. Or bipolar 2, which has depression, major depression or depressive episodes, and it swings between normal to that. Or manic, hypomanic. It could be manic or hypomanic. Hypomanic means a little less than the manic condition, hypomania they call it, to depression. So these are some of the conditions, and we'll discuss some more topics in this range, and also give some tips about how to encounter these and how to go about collecting data and information about these. Thank you all very much.